Imagine standing at your kitchen sink, rinsing a coffee cup, when suddenly the vision in one eye changes. Everything looks strangely gray, almost like the world has been covered by a sheet of old slate. It lasts only a few seconds. You blink, rub your eye, maybe look around the room, and then your vision returns completely. Because everything seems normal again, you continue with your morning and convince yourself it was probably nothing. But sometimes, a brief and unusual episode like that is your body giving you an important warning. A temporary change in vision, sudden weakness, confusion, difficulty speaking, or an unexplained loss of coordination can sometimes occur before a stroke. The frightening part is that these warning signs may disappear quickly, making them incredibly easy to ignore. Welcome to our channel, Longevix Hub. If you want practical health information that can help you better understand the signals your body may be sending, you're in the right place. Please do well to like, share, and subscribe to the channel. Today, we're going to explore 5 warning signs that should never be casually dismissed. Some can last only minutes, yet they may represent a serious problem with blood flow to the brain. Understanding them could help you recognize when something isn't right and seek medical attention before a more serious event occurs. Before we get into those 5 warning signs, it's important to understand what a stroke actually is. A stroke can happen when blood flow to part of the brain becomes blocked, or when a blood vessel in the brain breaks and causes bleeding. In either situation, brain tissue can become damaged because the brain depends on a continuous supply of oxygen and nutrients. Think about how quickly the brain works every second of your life. It controls your movement, speech, vision, balance, memory, breathing, and countless other functions. That is why an interruption in its blood supply can become an emergency very quickly. One of the most important things to remember is this. A symptom that disappears does not automatically mean the danger has disappeared. A temporary episode may sometimes be a warning that something more serious could happen. So don't simply brush off a strange episode because you feel completely normal afterward. Pay attention to what happened, how suddenly it began, how long it lasted, and what part of your body was affected. In the next sections, we'll break down the warning signs one by one, explain what they can look like in everyday life, and discuss why recognizing them early matters. Stay with me, because the first warning sign may appear so briefly that many people dismiss it without realizing how important it could be. The first warning sign is a sudden, temporary loss of vision in one eye. This is not the same as ordinary blurry vision from needing new glasses, having dry eyes, or waking up with a little irritation. What makes this warning different is how suddenly it begins and how strangely it feels. You may be sitting at the breakfast table, walking through the house, or looking outside when one eye suddenly seems to stop seeing properly. Some people describe it as a gray curtain coming down over their vision. Others say it feels as though someone placed a dark cloth over one side of their eye. It may last only seconds or a few minutes, and then the vision can return to normal. That sudden disappearance of vision can be frightening, but because it clears, many people make the dangerous assumption that the problem has solved itself. Imagine a woman in her early 70s who is working in her garden when her left eye suddenly becomes dark. She blinks repeatedly and waits. After less than a minute, her vision returns. She assumes it was dust, pollen, tiredness, or perhaps something related to aging. She continues gardening and never tells anyone. That is exactly the kind of event that should not simply be ignored. One possible reason for sudden temporary vision loss is a problem involving blood flow. A blood vessel in your neck, known as the carotid artery, carries blood toward your brain. Branches from this circulation also supply the eye. If a small clot or piece of plaque temporarily blocks one of those vessels, the retina may briefly lose its blood supply. When the obstruction moves away, blood flow can return and the vision may become normal again. But the fact that your vision returned does not necessarily explain why the episode happened in the first place. This is why sudden vision loss in one eye deserves medical attention, particularly when it appears without an obvious explanation. It is also important to distinguish this warning from other common visual experiences. If your vision gradually changes over weeks or months, that is different. If both eyes become blurry because you need a new prescription, that is different. If you stand up quickly and experience brief dimming or lightheadedness, that is also different. The warning we're discussing is sudden, unusual, and often affects one eye. If you have ever experienced something like this, don't rely on the fact that it disappeared. Make a note of what happened, which eye was affected, approximately how long it lasted, and whether you experienced any other symptoms at the same time. Then tell a healthcare professional as soon as possible. A temporary warning can be your opportunity to investigate the problem before something more serious occurs. The goal isn't to panic. The goal is to recognize that unusual symptoms deserve attention while there is still an opportunity to act. The second warning sign is a sudden change in the way you speak, understand words, or communicate with the people around you. This can be one of the most noticeable warning signs, but it is also one that people sometimes explain away as ordinary forgetfulness. There is an important difference between occasionally forgetting someone's name and suddenly being unable to communicate normally. Almost everyone has moments when a familiar name disappears from memory for a few seconds. You may recognize someone's face, remember where you know them from, and still struggle to remember their name. That kind of occasional difficulty is not what we're talking about here. A more concerning episode happens suddenly. You may know exactly what you want to say, but the words come out slurred, incomplete, or strangely distorted. Your mouth may feel as though it is no longer cooperating with your brain. You might try to form a simple sentence and discover that the sounds coming out are completely different from what you intended. Another possibility is that your speech sounds perfectly clear, but the words themselves don't make sense. You may intend to ask someone where the car keys are, yet produce a collection of unrelated words. Or someone may speak directly to you, and although you can hear their voice, you suddenly struggle to understand what they are saying. These episodes can be brief. You might experience the problem for a minute or two, and then suddenly return to normal. That quick recovery can make the event especially easy to dismiss. Imagine an older man sitting at breakfast with his wife. He looks up from his plate and suddenly begins saying words that don't belong together. His wife asks him a simple question, but his response makes no sense. 90 seconds later, he is speaking normally again and believes nothing unusual happened. That temporary episode should not automatically be treated as a harmless senior moment. The brain has specialized areas involved in producing and understanding language. When blood flow to one of these regions is temporarily interrupted, communication can suddenly become difficult. The key difference is the suddenness and the extent of the problem. Forgetting one word while the rest of your conversation remains normal is different from suddenly being unable to form understandable sentences, suddenly speaking with severe slurring, or suddenly being unable to understand what another person is saying. If this happens to you or someone near you, take note of exactly what occurred. Don't simply say, "I felt strange." Explain whether the person couldn't speak, couldn't understand, used unusual words, or suddenly sounded severely slurred. Even if everything returns to normal after several minutes, the episode deserves prompt medical attention. A temporary neurological problem can be a warning that blood flow to part of the brain is being disrupted. So, if someone's speech suddenly falls apart and then returns, Don't automatically laugh it off, blame tiredness, or call it aging. Pay attention to the timing. Take the symptom seriously and seek appropriate medical evaluation. The third warning sign is more unexpected because, at first glance, it may seem to have nothing to do with the brain at all. It involves a new pattern of headaches, especially when those headaches appear alongside other unusual changes in the body. A headache by itself does not mean a stroke is coming. Most headaches have much more ordinary explanations. But when someone develops headaches that are completely different from anything they've experienced before, especially later in life, that change deserves attention. Pay attention if the headache suddenly becomes much stronger than your usual headaches, appears in an unfamiliar location, wakes you from sleep, keeps returning in a new pattern, or no longer responds to the medications that normally help you. The important point is not to assume that every headache is dangerous. Instead, look for a significant change from your normal pattern. For example, imagine someone who has rarely experienced headaches throughout their life. Suddenly, over several weeks, they begin developing intense pain around the back or side of the head. The sensation is unfamiliar, persistent, and different from anything they've previously experienced. Rather than automatically assuming it is simply part of getting older, that person should tell a healthcare professional exactly what has changed. The original script also connects this warning with autoimmune-related skin changes, such as vitiligo. Vitiligo causes areas of the skin to lose pigment and become noticeably lighter. The script uses this as part of a broader discussion about inflammation and blood vessels. However, having vitiligo does not mean that someone is destined to have a stroke. It should not be treated as a diagnosis or a prediction. What matters more is recognizing when several unusual changes appear together and discussing them with a qualified healthcare professional. There is another important consideration, particularly for older adults. Not every new headache comes from the same cause. Problems involving the neck, muscles, nerves, eyes, medications, blood pressure, or other conditions can also produce headaches. That is why the safest approach is not to diagnose yourself from a video. Instead, recognize a significant change and get it evaluated. Women can also experience neurological warning symptoms that don't always resemble the classic examples people expect. Sudden confusion, unusual weakness, unexplained nausea, overwhelming fatigue, or a strange episode where something simply feels wrong can sometimes be overlooked. The lesson is simple. Don't ignore a completely new neurological symptom just because it disappears or because it doesn't look like the textbook picture. When your body suddenly behaves differently, especially after years of having a predictable pattern, take notice. Write down what happened, when it started, how long it lasted, and what other symptoms occurred. That information can help your healthcare professional determine whether further evaluation is necessary. The fourth warning sign is a sudden change in your balance or coordination, the kind of episode that can make you look or feel as though you've had too much to drink, even when you haven't touched alcohol. Imagine walking across your living room on a perfectly ordinary day. You know the route. You've walked across that same floor countless times. Suddenly, one foot seems to land incorrectly. You stumble toward the furniture and have to grab the back of a chair to steady yourself. For a few moments, you may feel confused about what just happened. Then, almost as quickly as it began, your balance returns. You might also notice that your hand suddenly misses its target. You reach for a glass sitting directly in front of you, but your hand moves farther to the side. Or you stand up and suddenly feel that the room is spinning, even though you're standing completely still. These symptoms can sometimes involve the cerebellum, a region of the brain that plays an important role in balance, coordination, posture, and controlled movement. The cerebellum constantly helps your body make tiny adjustments so you can walk, reach, turn, and maintain your balance without consciously thinking about every movement. Blood vessels supplying the back portions of the brain are therefore important. If blood flow is temporarily disrupted, coordination can suddenly become abnormal. But here's something important. Not every episode of dizziness or imbalance is a stroke warning. Inner ear problems, low blood pressure, medications, dehydration, and other conditions can also cause dizziness or unsteadiness. The concern is a sudden neurological change that is unusual for you, particularly when it happens without an obvious explanation. Think about someone carrying laundry through their home when one foot suddenly seems to move incorrectly. They catch themselves against the doorframe, stand still for a moment, and then continue walking normally. Because the episode disappears, they may never mention it. That is exactly why sudden coordination problems can be overlooked. If something like this happens, describe it clearly to your healthcare professional. Don't simply say, "I felt a little dizzy." Explain exactly what happened. Whether you stumbled, veered to one side, couldn't control a hand, experienced sudden spinning, or felt unable to coordinate a familiar movement. And if the imbalance occurs together with sudden weakness, facial drooping, speech difficulty, vision changes, or severe confusion, treat it as an emergency and seek immediate medical help. Your balance is something your brain normally manages almost automatically. When that ability suddenly changes for no obvious reason, it deserves your attention rather than dismissal. The fifth warning sign is sudden numbness, tingling, or weakness affecting one side of your body. It may begin in your hand, travel through your arm, affect one side of your face, or involve one leg. Sometimes the sensation is described as pins and needles. Other times, the affected area may feel heavy, strangely numb, or as though it has suddenly become disconnected from the rest of the body. The two details that deserve particular attention are sudden onset and one-sided involvement. Your brain and body are connected in a fascinating way. The left side of the brain generally controls movement and sensation on the right side of the body, while the right side of the brain generally controls the left side. Because of this arrangement, a problem affecting one side of the brain can produce symptoms on the opposite side of the body. Imagine sitting comfortably in your favorite chair when your right hand suddenly becomes numb. You try to grip the remote, but your fingers don't seem to cooperate. You haven't slept on your arm, you haven't been leaning against it, and nothing obvious explains the sensation. After several minutes, everything returns to normal. That temporary recovery can be misleading. Many harmless situations can cause numbness. If you've been lying on your arm and it becomes tingly, the sensation usually improves after you change position. If your foot falls asleep after sitting awkwardly, you can generally explain why it happened and why it improves when you move. A sudden episode that appears without an obvious cause is different. The same applies when one side of your face suddenly feels unusual, one arm becomes weak, or one leg seems difficult to control. You may not experience complete paralysis. Sometimes the change is subtle enough that you simply feel that one side isn't working normally. Don't dismiss that feeling. If it happens, remember what time it started and how long it lasted. Notice which side was affected and whether anything else happened at the same time, such as difficulty speaking, changes in vision, confusion, dizziness, or trouble walking. Most importantly, don't assume that because the sensation disappeared, the event was harmless. Sudden one-sided neurological symptoms can require urgent evaluation. If they are happening now, especially alongside other stroke symptoms, seek emergency medical attention immediately rather than waiting to see whether they disappear. Your body may only give you a few minutes of warning. Those minutes are valuable, and recognizing what they mean can make the difference between ignoring an important signal and getting the help you need. Now that we've covered the 5 warning signs, let's connect them, because they may seem like completely separate problems when they can sometimes point toward the same underlying issue: disrupted blood flow to the brain. Your blood vessels have a delicate inner lining called the endothelium. Think of it like the smooth inside surface of a brand new garden hose. When that lining is healthy, blood can move through the vessel efficiently. But years of uncontrolled risk factors can damage that surface, making it rougher and more vulnerable to plaque and clot formation. One major contributor is persistently elevated blood sugar.
You don't necessarily need to have diagnosed diabetes for blood vessels to be affected. Blood sugar that remains too high over time can contribute to vascular damage. Smoking is another major concern. Cigarette smoke exposes blood vessels to chemicals that can injure the vessel lining and increase the tendency for blood to clot. High blood pressure also matters. Over many years, excessive pressure can place tremendous stress on artery walls and contribute to plaque formation and vascular disease. This is why stroke prevention isn't only about recognizing symptoms after they appear. It also means understanding the conditions that gradually affect your blood vessels long before a serious event occurs. The important takeaway is that these risks can build quietly for years. By the time a major problem occurs, the damage may have been developing without obvious symptoms. That's why regular medical checkups, blood pressure monitoring, appropriate blood sugar testing, avoiding tobacco, and discussing your personal stroke risk with a healthcare professional are so important. Your body doesn't always give you a dramatic warning. Sometimes prevention begins with paying attention to the quieter changes and managing the risks before they become an emergency.
Now let's move from warning signs to the practical steps you can discuss with your healthcare professional. If you've experienced any of the symptoms we've covered, even if they happened months ago and disappeared completely, don't assume there is nothing worth investigating. One test that may be discussed is a carotid ultrasound. This painless examination uses sound waves to look at the major arteries in your neck and assess blood flow and plaque. It can help your healthcare professional determine whether narrowing is present. Another useful test is hemoglobin A1C, often written as HbA1c. This blood test provides an estimate of your average blood sugar levels over approximately the previous 3 months. It can help identify elevated blood sugar that may otherwise go unnoticed. A third evaluation may involve heart rhythm monitoring. An extended monitor can detect abnormal rhythms, such as atrial fibrillation, which can sometimes come and go and therefore be missed during a brief office electrocardiogram. The exact tests you need depend on your symptoms, medical history, and examination, so discuss them with a qualified professional rather than ordering tests yourself. There is one final safety point to remember. If any warning sign suddenly happens, don't drive yourself to the hospital. Don't wait for symptoms to disappear, and don't assume you can sleep it off. A possible stroke or transient ischemic attack needs prompt medical assessment. Don't automatically take aspirin because you think every stroke is caused by a clot. Some strokes are caused by bleeding, and aspirin can make bleeding worse. Seek urgent professional help and let medical personnel determine what is happening. Write down the exact time the symptoms began. That detail can be important because treatment decisions may depend on when symptoms started. If you're with someone experiencing sudden weakness, facial changes, speech difficulty, vision loss, or severe coordination problems, stay with them and get emergency assistance. Acting quickly isn't about panic. It's about recognizing that brain symptoms deserve attention. The faster the situation is assessed, the sooner treatment can begin. As we come to the end, remember the 5 warning signs we discussed today. Sudden vision changes in one eye, unexpected problems with speech or understanding, a completely new or unusual headache pattern, sudden loss of balance or coordination, and sudden numbness or weakness on one side of the body. These symptoms don't automatically mean that a stroke is happening, but they are important enough that you should never casually dismiss them. A symptom that disappears can still deserve medical evaluation, especially when it began suddenly and had no obvious explanation. Your brain depends on a constant supply of blood and oxygen, and when that supply becomes disrupted, time matters. Don't wait for a symptom to become severe before taking it seriously. Pay attention to what your body is telling you. If something suddenly changes, remember when it started, what you experienced, how long it lasted, and whether anything else happened at the same time.
share those details with a healthcare professional. You deserve to understand your health, ask questions, and receive clear explanations. Don't be afraid to speak up during medical appointments or ask for another opinion when you need clarification. Most importantly, don't let a brief warning give you false reassurance. When something unusual happens, getting checked can be far safer than simply hoping it never happens again. Thanks for watching. Please like, share, and subscribe to Longevix Hub. Your support helps us continue creating practical health information that can help more people recognize important warning signs and take action when it matters. Take care of yourself, pay attention to your body, and remember that acting early can be incredibly important.